Okay, let's talk about the future of medicine. A future where we don't just flood the body with drugs, but instead send a tiny, microscopic delivery vehicle right to the source of the problem. Imagine a remote-controlled robot swimming through your bloodstream to drop off medicine at a tumor or a blood clot and leaving all the healthy stuff completely alone. Sounds like something out of a sci-fi movie, right? Well, some incredible new research is making that a whole lot closer to science fact.
This really gets to the core of the problem that scientists have been trying to solve for decades. When you take a pill or get an IV, that medicine goes everywhere. But what if the problem is just in one tiny spot in your brain or one specific organ? How do you get the cure exactly to the disease without collateral damage to the rest of your body?
And that's the huge downside of what's called systemic administration. Think about powerful treatments like chemotherapy. They are absolute lifesavers, but they don't discriminate. They attack healthy cells right along with the cancerous ones, and that's what leads to all those awful side effects. It's kind of like carpet bombing a city to take out a single building.
And the consequences of that approach are just huge. Look at this number, 30%. That's the percentage of really promising drugs that end up failing in clinical trials. It's not because they don't work on the disease. It's because the off-target side effects are just too severe for patients to handle. It's a massive, massive roadblock in developing new medicines.
So how do you get around that? Well, this is where our hero enters the story. Researchers have developed a complete end-to-end platform centered around a brand new type of medical device, a magnetically guided microrobot. Now, when you hear microrobot, you're probably picturing some tiny metal machine with propellers, right? But that's not what this is. It's actually a tiny, dissolvable sphere, smaller than the head of a pin. It's designed from the ground up to be biocompatible, so your body doesn't freak out, and it's biodegradable, which means it just dissolves after its job is done. No need to go back in and get it.
The brilliance here is just how much function they packed into this little thing. The main body is just gelatin. Yep, like Jell-O, which can be made to dissolve with a little bit of hate. Mixed into that gelatin are iron oxide nanoparticles. That's what makes it magnetic, so you can steer it from outside the body. Then you've got tantalum nanoparticles, which are key because they make the robot show up on an X-ray, so doctors can actually see where it is in real time. And of course, the most important part, the therapeutic cargo, whatever specific drug is needed for that mission.
A tiny robot is one thing, but it's pretty useless if you can't actually control it. So to make this whole thing work, the researchers had to build an entire mission control system to launch it and guide it with pinpoint precision once it's inside the body.
Think of it as a toolkit with two main parts. On one side, you've got the steering wheel. This is the double Navion system. It's basically a set of powerful computer-controlled electromagnets that sit outside the body. They create these incredibly precise magnetic fields that allow doctors to pilot the microrobot in real time. Then, on the other side, you have the launch vehicle, a specially designed catheter. This thing carries the robot safely through the bigger blood vessels and then releases it right at the starting line of its journey. Kind of like a transport ship dropping off a tiny scout. Navigating the human bloodstream is, well, it's a crazy environment. You've got super fast currents and arteries, slow meandering flows, and all these complex branching pathways. To handle all that, the team gave the microrobot 3 different ways to move. You could almost think of them as 3 different superpowers for getting around. Okay, first, in really slow-moving areas, like the fluid around your brain, they can use a rotating magnetic field to just roll the robot along the wall of the vessel. Simple and effective. Second, if they need to go against the current, they can switch modes and use a strong magnetic gradient to literally pull the robot upstream, fighting against the flow. But the third method is the most clever one, inflow steering. In those big, fast-flowing arteries, they let the blood flow do all the hard work for speed, and they just apply a little magnetic nudge to steer the robot into the correct fork in the road.
So how well does that steering actually work? Well, the results are pretty staggering. Even in simulated arteries with blood flowing at 84 centimeters per second, which is really moving, that inflow steering method had a 95% success rate at getting the robot into the right branch. That's the kind of precision you absolutely have to have if this is ever going to be used in a real person.
Now, all this sounds fantastic in a lab, but the real test is seeing if it works under realistic conditions. So the team put the entire platform through a super rigorous series of tests, moving from a 3D printed model all the way to a large animal in a setting that mimics a real clinical procedure.
You can really see how carefully they built up their case here. They started with a 3D printed replica of a real patient's brain arteries.
Once they proved they could navigate that, they used that same model to deliver a real drug to a real human blood clot. Then they raised the stakes, moving to an animal model to navigate the super complex central nervous system of a sheep. And the final exam, a full clinical simulation in a large pig using live X-ray imaging, where they successfully proved all 3 navigation modes worked as planned.
Let's just focus on that stroke treatment test for a second, because it's the perfect proof of concept. So, they loaded up a microrobot with RTPA, which is a powerful clot-busting drug. They steered it right up to a human blood clot inside their model. Then, they used an external magnetic field to gently warm up the nanoparticles inside the robot. This heat melted the gelatin capsule, releasing that drug payload directly onto the clot.
And the result? Just 7.5 minutes. That's how long it took after the drug was released for blood to start flowing through that vessel again. In less than 20 minutes, the blockage was substantially cleared. This shows it's not just precise, it's also fast, and speed is absolutely everything when you're treating a stroke. So you have to understand, this is so much more than just a single invention. It's an entire integrated platform. You've got the robot, the navigation system, the delivery catheter, and it's been proven to work under very realistic clinical conditions. This really opens the door to a completely new way of thinking about how we treat disease. The possibilities here are just mind-boggling. You could send chemotherapy directly into a tumor, getting the maximum killing power while minimizing the horrible side effects. You could deliver a super concentrated dose of antibiotics right to a deep-seated infection. You could even imagine using these robots for microscale surgeries in really delicate places like the brain or the eye. The core idea is always the same: make medicine more effective by putting it exactly and only where it needs to go.
And that really is the main takeaway here. In fact, the researchers themselves put it perfectly in their conclusion. They said, "Our results provide a robust framework for addressing the complex challenges associated with targeted drug delivery." They haven't just built one cool gadget. They've created a foundational platform that other scientists and doctors can now use to solve some of the toughest problems in medicine.
It's a pretty exciting thought, isn't it? Now, there's still a ways to go before this is a routine procedure at your local hospital, but this research gives us a really powerful glimpse into a future of truly precise, targeted therapies, a future where our treatments aren't just more powerful, but also a whole lot gentler on the human body.